Hello, today we are talking to Miss Decker, a mother who experienced preeclampsia firsthand with her first pregnancy. Did you have any prior knowledge of preeclampsia before your diagnosis?
Yes, I did. So my oldest sister also developed preeclampsia in her first pregnancy and HELLP syndrome in her first pregnancy. So I knew of it.
Did this help you during your pregnancy, knowing that your sister had it?
I had OBGYNs who asked if I had a family history of preeclampsia, so I knew I had the family history, but it didn't change anything during my prenatal visits. There was never any indication that I would have preeclampsia, so I knew of it, but I never expected that I would get it.
If any, what symptoms did you experience?
So I had upper epigastric pain, I had right shoulder pain, lightheadedness, extreme fatigue, and very high blood pressure.
Did you have to deliver early?
Yes, so I delivered 7 weeks early with an emergency C-section.
Did this affect your baby at all?
It did. So she, prior to the emergency delivery, I was able to get shots for her lung development, but since she was so early, she spent 38 days in the NICU.
How was the diagnosis process?
So I was sick, I had really high blood pressure, so I felt off all day and I knew to go to the hospital. And then once in the hospital, I was diagnosed as severely preeclamptic within 20 minutes of being there. And then within 5 days of being in the hospital, I developed HELLP syndrome. So that's diagnosed with blood pressure readings and then blood monitoring, looking at all of your liver enzymes and platelet count. So they were able to diagnose it through that.
Did they have to do prenatal appointments more often?
No, I went to my regular prenatal visits and I never had any signs of preeclampsia prior to 32 weeks. So everything was normal until then.
What was your recovery process like?
So 24 hours after the C-section, I was on magnesium sulfate to prevent strokes and seizures. And then once I left the hospital, I was on blood pressure medication for 6 days. And then I discontinued it. But it did affect like overall recovery from the birth a lot differently. Yeah.
How are you and your baby now?
We're good now. She's home and she's almost 4 months old. On June 3rd, she'll be 4 months old. And she's healthy, and I have no remaining side effects from the preeclampsia.
Good. Is there anything else you'd like to share that I didn't ask you that you think is important for people to know?
Yeah, so preeclampsia, there's different types of hypertensive disorders. It can develop into HELLP syndrome. I think it's important for people to know what it is. There is very little research. It's Preeclampsia Awareness Month. Right now, the only cure to the syndrome that I developed is delivering the baby. There's no other treatment they can do besides taking the baby out. So I think people are always surprised when they hear that, that's a treatment. So that's often why babies are delivered early with HELLP syndrome. It's also very rare though, so never expected it, but it is also genetic. So me and my sister both had it, but they are not sure what to do to prevent it. So I think it's important for research so the next generation can figure out how to prevent it.
I would just like to thank you for taking this time to speak with me today about your firsthand experience as a patient with this condition.
Thank you.